Hi, this is Brian Kim. I'm going to share with you case number 58 in the best way to do cataract surgery series. This is a moderately dense lens, and you're going to see my standard technique, double chop, cross chop, mechanical fracturing, which allows me to disassemble the lens without ultrasonic energy and vacuum. And so this is the lens here. I'm using a cotton tip to hold and center the eye. I'm using a corneal marker to help me to center and size my rexus. And then I'll make my paracentesis incisions on the right side and the left side. This is actually a left eye. I make my incisions flat to the iris plane, which creates a nice corneal shelf, which will allow me to make a self-sealing corneal incision. I'm injecting some intracameral lidocaine and then some dispersive viscoelastic. I'm going to use a cannula to hold the eye so I can make my triplanar corneal incision. So you can see I'm using the cannula to turn the eye away from me a little bit. I make a vertical groove, place the blade into the deep part of the groove. I'm turning the eye away from me with the cannula, tunnel through the cornea, and then when I'm ready to enter, I turn the eye towards me with the cannula, and then I enter. That's the triplanar corneal incision, using the cannula to control the eye. And I go in with the teeth of the forceps turned sideways, and I go in. This is the puncture style rexus. I puncture, and then I pull towards me, and I grab the right side of the tear to create a flap. And I keep kind of pinching so that I can extend that tear to the point where I feel like I get the correct diameter. And then I start to go around with the rexus, grabbing and re-grabbing the flap as I go, and trying to use the corneal markers, which will hopefully help me center and size the rexus. I burp some viscoelastic out of the eye, and this is the capsular fornix hydrodissection technique. I place a cannula out underneath the rexus edge contra-incisionally. I point the tip down, you get a nice fluid wave. Turn the tip up, decompress on the left side, and then I'm going to point the tip downward and then start to spin the lens. This just gives me very consistent hydrodissection waves by doing it this way. Go ahead and irrigate the surface of the cornea, make sure my sleeve is appropriately sized. I lift the incision with a chopper, going in with irrigation off to minimize Descemet's trauma. I'll start to remove the surface epinuclear material, and I'll place the chopper underneath the epinuclear ridge, which ensures I'm inside the bag. Place the chopper into the equator, turn the ficca tip vertically subincisionally, bringing both instruments together, crushing and dividing the lens completely. That's the double chop. Place the chopper around the contralateral equator, pulling it centrally against the ficca tip, crushing it, and dividing the right heminucleus. That's the cross chop. I'm using a little bit of vacuum to pull that first quadrant up, and then fracturing it between the chopper and the ficca tip, using successive mechanical fracturing maneuvers to reduce the size of the lens piece, and then emulsifying using ultrasonic energy and vacuum. Place the chopper underneath the rexus edge around the second quadrant, pulling it centrally, crushing it and dividing it against the phaco tip, and then using vacuum to grab some of the fragments, positioning it on the tip, and then crushing it with mechanical fracturing forces, and then emulsifying the lens pieces. I'm getting under that piece of the second quadrant with the chopper, hooking it, pulling it up, and then using mechanical fracturing forces to crush the lens pieces into smaller pieces, and then emulsifying the lens piece. I'm turning the second heminucleus in front of me, place the chopper around the lens piece, pulling it centrally towards the ficca tip, crushing and dividing the lens piece, using a little bit of vacuum to grab that third quadrant, and then sandwiching it with the chopper and ficca tip. Once I crush the lens piece into smaller pieces, emulsify the lens pieces. You can see this is a very controlled and systematic way to disassemble the lens. This is the final quadrant. Place the chopper around the lens piece, pulling it towards the ficca tip, crushing and dividing the lens piece, successively crushing it with the chopper against the ficca tip, and then once they're small enough, emulsifying the lens pieces. Once the endonucleus is removed, I grab the anterior edge of the epinucleus and it starts to prolapse out. And that's the epinuclear removal. I take the chopper out, push BSS in, take the phaco tip out, and go in with the INA handpiece. I always start subincisionally. You have a nice anterior component of the cortex, so I peel that from anterior to posterior, again starting subincisionally because this is really the easiest time to go after the subincisional because you still have a protective layer of cortex surrounding you. So very carefully, again, going from anterior to posterior, sweeping side to side tangentially. Once I get all that cortical material removed, I switch to the polish mode and start polishing under the rexus edge. Once I'm satisfied, I'm going to pulse BSS into the subincisional capsular fornix to see if there's any hidden cortical material. In this case, it was clean. And then I'll inject some cohesive viscoelastic to inflate the capsular bag. And then I'll go with the capsule sweep, which will allow me to polish underneath the rexus edge. First on the left side, and then on the right side. I'm injecting the single-piece acrylic intraocular lens into the capsular bag with the leading edge inside the bag and the trailing edge outside of the bag. I go in with the INA handpiece, turn the irrigation on, disengage the haptics off the optic, go underneath the lens, tilting it up, rotating it 90 degrees clockwise, tilting it and going under the lens, removing all the viscoelastic from within the bag, polishing underneath the rexus edge to remove any fine cortical material. And if I see any more fine lens material between the lens and the bag, I go in and remove that as well. And then I'm turning the lens so that the haptics are in the horizontal orientation to reduce the risk for negative dysphotopsia. So I polish underneath the rexus edge, and once I'm satisfied, I switch to visco mode and remove all the viscoelastic from the anterior chamber. And then I'll hydrate my incisions after that. And so you can see, using the corneal marker, I have a really pretty, well-centered and sized rexus. This was a moderately dense lens, not a terribly dense lens, but a pretty standard density. And again, you saw double chop, cross chop mechanical fracturing techniques in a very careful and systematic way to disassemble the lens. You could see it's very systematic, it's very predictable. And that's the beauty of this technique, is no matter if they're small pupils, dense lenses, soft lenses, you can do the technique very consistently the same exact way. Why? Because you're using mechanical techniques and utilizing your instruments to be able to access the lens in a very confident and predictable way. So I hope this was helpful to you, and I thank you for your attention.